Hello everyone, and welcome to EDTNAERCA Webinar. Hemodialysis patients, a very vulnerable population, traveling to dialysis units 3 times a week, being surrounded by many other patients and staff. All this could predispose them to a greater risk for the COVID-19 infection. Mortality associated with COVID-19 infection is high in patients receiving dialysis as well. Therefore, vaccination is crucial to protect these patients. We all know that vaccines are one of the most effective tools to protect health and prevent disease for all of us. The effectiveness rates of COVID-19 are good for general population. However, the effectiveness of COVID-19 vaccine to the hemodialysis patients is under discussion and under investigation until now, especially when we can see the rates that of COVID-19 rises all over the Europe due to the Delta variant. So it's my honor to present Dr. Khalid Hazem, my colleague and the senior physician in the Department of Nephrology or Hypertension in Galil Medical Center, Nahariya, Israel. Dr. Khalid is a member of the Israel Society of Nephrology and Hypertension and a board member, the obesity work group of the ERA EDTA. And today he will present the results of his study on the topic of humoral response to the COVID-19 vaccine in dialysis patients. During the presentation, you can write your question and we will open the discussion immediately after the presentation. So Dr. Khalid, the screen is yours. Welcome to the webinar.
Okay, thank you, Tanya, for the introduction. I will share my presentation. Just a minute, please. Share. Okay. Let me see. Okay, thank you, Kenya. Thank you for the invitation and for the opportunity to talk about the humoral response to COVID-19 vaccines in a hemodialysis patient. Just a minute, please. Okay. As we know, the novel severe acute respiratory syndrome coronavirus 2 or SARS coronavirus 2 was first identified in Wuhan, China in the late 2019. The disease caused by this coronavirus, named coronavirus disease or COVID-19, as we will call it in this presentation. The initial of the disease was in a patient with respiratory syndrome and severe distress syndrome. Due its wild world and fast spread in all the world, in March 2020, it was declared as a pandemic by the WHO organization. As it is now the cause of the worst global pandemic of our lifetimes. Early reports, mainly from China, where the disease was discovered, identified that chronic kidney disease is a risk factor for the severe disease and increased mortality. As we see here, almost this data published a few days ago from the WHO dashboard, almost more than 190 million persons worldwide are confirmed cases with COVID-19, and more than 4 million deaths worldwide was reported in the last 2 years. In Europe, almost we have 60 million patients confirmed with the COVID-19 infection. The mortality rate was reported high due to the COVID-19 infection compared with most of the other viral infection. And it was the mortality rate differed from regions and according to the reports. As we see here, the fatality rate in China was reported 2.3% of the patient, but in Europe, the average mortality rate was almost 11.7%. The range varied from 0.6 to 18 to almost 19% of the patient in the general population in Europe. And among hospitalized patients in the United Kingdom suffering from the severe COVID-19 cases, the case fatality rate reached that 26%. As we all know, CKD, chronic kidney disease, is associated with a state of immune system dysfunction. It's both the humoral and cellular type cell of immune system function. For patients with end-stage kidney disease have an increased infection rate caused by both bacterial and virus pathogens. In HD patient hemodialysis, chronic hemodialysis patients have a pure immune response compared to the general population, as it was published previously by several data and reports. Patients who are on hemodialysis treatment who received the hepatitis B virus vaccine developed a protective antibody only in 50 to 70% of the patient, thus to the lower capacity of the humoral immune function. And only 40% of HD patients who received the H1N1 influenza vaccine had seroconversion after the vaccination. So it was previously anticipated that patients on hemodialysis will have a high prevalence of infection to COVID-19. And the prevalence, it was studied in by several groups of clinicians in Europe and in other places in the world. This data published from London, England. They studied the incidence of the COVID-19 infection among patients with in-center hemodialysis patients. They recruited 376 patients. From them, 20 patients declined their consent form, and only 356 patients included in the study. From these 365 patients included in the study, 235, 66, 2/3 of the patients, they have no PCR exam because there was no reason to check the PCR nasopharyngeal swab for these patients. They have no symptoms, they were asymptomatic with no exposure to patients. And from these patients, asymptomatic patients, almost 19% have antibody positive for the COVID-19 virus. Also in patients who were suspected for the COVID-19, but the PCR was negative, also in these patients, 19% have the positive antibody. And in patients who were positive for PCR, almost 97% have positive antibody. This data showed us that asymptomatic patient, HD patient, will have almost 20% of this patient, asymptomatic patient, are infected by the virus. That showed high prevalence of the virus infection among HD patients. Similar data were published also in Madrid, Spain. And this is a retrospective observation study who was conducted on 66 patients on hemodialysis. From 66 patients, a nasopharyngeal PCR test of COVID-19 was performed. Okay, 42% of these, 42 of them were due for symptoms, 19 for close contact, and 5 without close contact. As we see here in the left side, 80%, 28 patients have PCR negative. From these 89% who were PCR negative, 12 patients have a positive antibody. It's almost 19% of the patients who were examined and asymptomatic have a positive antibody that show that show the reality that the patient with asymptomatic patient, almost 20% of them have been infected. In general, as we all know, that HD patients have higher mortality than the general population. The rate of mortality in HD patients is 8 to 9 times higher than the age-matched people from the general population. This is in normal circumstances. COVID-19 infection caused higher rate of mortality among HD patients. And several case series from Italy, Spain, and the United States with varying follow-up suggest a high mortality rate in dialysis population, with rates that ranging from 29 to 41% of mortality among infected patients with COVID-19, HD patient, compared to the mortality rate that ranged from 2.3 to 10% in the general population, as it was shown previously. The results from the ERA EDTA registry indicate a high mortality due to COVID-19 in dialysis patients. As we see here, patient on hemodialysis with COVID-19 infection are at increased rate, are 20-fold increased risk of mortality compared to hemodialysis patient without COVID-19 infection. In addition to the impact on the hemodialysis or renal replacement therapy, as we see here, renal replacement therapy patient, dialysis or transplanted patient are at increased risk of prevalence of COVID-19. It ranges from 3.5 to 70.5 in patients on dialysis. They are at, as it was shown previously, at increased risk of death. The rate of death in patients with on dialysis at almost 20%. As a nephrologist, we have to treat patients with acute kidney injury due to the COVID-19 infection, include patients with sepsis, do inflammation, severe ARDS caused endothelial function, hypoxia, acute kidney injury, and the risk of AKI in patients with COVID-19 is about 30 to 50%, and it increased mortality, causes increased mortality risk in the ICU to 40 to 60%. So the impact of COVID-19 on the nephrology societies and the nephrologist staff, medical treatment persons have a great impact, a huge impact, and a great, huge work that we did in the last 2 years as a medical treatment staff. Recommendation for the prevention and the mitigation of containment of COVID-19 in HD centers, it was published almost more than 2 years ago by the ERA EDTA. It concerned for the recommendation for the healthcare team and for the dialysis patient. Regarding the healthcare team, as we this recommendation was also done by our staff here in Nahariya and in all in Israel. The staff were trained to use personal protective equipment. They have to inform the team leader if they have symptoms or contact with the proved cases of COVID-19, to stay at home if they have fever or respiratory systems. And we also recommended for the dialysis patient to provide, we provided them clear instruction to inform either staff meeting if they have any symptoms of respiratory symptoms, fever, or contact with confirmed COVID-19 patients. We instructed them to have appropriate hand and respiratory hygienes, to measure body temperature before the start and the end of the dialysis. They were instructed to be self-isolated at home. The symptomatic patients were treated in a different units and in isolated room. Also, the quarantine patients were treated in different and isolated rooms for the dialysis treatment. Since it was the high rate of mortality and the huge economic burden for the treatment of dialysis patients with COVID-19, and there was an urgent need for vaccination to prevent the disease. All the national and international societies of nephrology called for urgent vaccination of COVID-19 virus for dialysis patients. We have almost 3 million dialysis patients worldwide. Most of them, about 90% of them, receive in-center haemodialysis. They come usually thrice a week and travel to the center, so they are exposed to many other patients, to staff, and to ambulance, and to other people. So the social isolation of these patients, it's very high. As it was shown that they have higher mortality rate than the general population. Also, patient, we saw that another non-COVID complication. In general, we saw that some patients reduced the frequency of dialysis, reduced compliance of dialysis, because they were afraid to be in contact with other patients and the staff contaminated or infected with the virus. In December 2020, the first emergency use authorized for COVID-19 vaccine was approved by the FDA. As we saw in the preclinical and clinical study trials, that were published from Moderna and Pfizer, most of the patients were CKD and end-stage renal disease were low number of patients or unreported. So the vaccination for dialysis patient wasn't approved yet by the FDA, but in Israel, we saw that we have an urgent vaccination for HD patient because of the high mortality, the low response of the immune systems. So we started the vaccination in the early 2029, and so in some units, the patient started the vaccination in the late of December 2020. So in Israel, we have the first data published about the seroconversion in dialysis patient who got the vaccine after two shots of vaccine. As we see here, it's in two dialysis units in the north of Israel. They were enrolled 160 patients and a control group of 132 healthy control group who completed the dose of 2 doses of vaccination by the Pfizer mRNA vaccine. The anti-spike protein antibodies response were measured at least 1 week after the second dose of the vaccination. As the result showed that a total of 90% of the dialysis group and 100% of the control group were positive for the anti-spikes antibody. But also the dialysis patient have a seroconversion. The median level of the anti-spike antibody was 116 in the dialysis group and compared to 176 in the control group. It was significantly lower than in the control group. And also this group of clinicians show that 6 of their HD patients, it's 3.7% of the patient, of the HD patient, and none of the control group developed a new COVID-19 infection after 7 days after the completion of the recommended vaccination regime. Another group from Israel, from Tel Aviv, the Tel Aviv region, they did a similar study and examined the seroconversion of 56 HD patients in center HD patient compared to 25 healthcare worker, the medical staff who received the Pfizer vaccine mRNA. As we see here, 96% of the dialysis patient developed antibody response, and the median level of the IgG levels, it was 3,946 units per milliliter. And the control group, then the healthcare worker group, 100% of the control group developed antibody response with higher levels, significantly higher levels of the IgG levels. They found that older patients, more than 75, have less response for the IgG, for the mRNA COVID-19 vaccine, As it was, also in the general population, all the patients have developed less levels of IgG of antibodies. Dialysis patients have less response, but they found that higher lymphocyte count has a protective effect against the protective events, and the patient who with a higher lymphocyte count developed more antibodies. In Israel, for now, all the patients and were received the Pfizer vaccine. So our data also regarding the Pfizer mRNA vaccine. In our units, we also examined that the level of response of antibody in our units of dialysis patient. We have enrolled 72% high dialysis patients who received the vaccine, and 2 weeks after the second dose, we checked the antibody response, and we have that almost all of our patients developed antibody response. Nearly 89% of our patients developed antibody response. But the level of the IgG levels were lower than the control group, as it was published by the other groups in Israel. Similar data were published also from Europe. This as it was from Austria, they checked the levels of IgG antibody in control group and compared it to the dialysis group. As it was shown in Israel, the levels of antibody were lower in the dialysis group. Regarding the Moderna vaccine, the mRNA 1273 or Moderna vaccine, the published data came from Spain. As we see here, they followed up the level of the percent of IgG antibody response after the vaccination. They compared after the first dose, the 4th week, before the second dose of the second dose of the vaccine. 56% of the patient developed a protective effect of antibody. But after the second dose that was performed on the 4th week, after the second dose, 2 weeks after the second dose, almost 94% of the patient developed seroconversion, and we have protective antibodies as it was published from the Pfizer vaccine. In another group from Spain, they checked the humoral and cellular response to mRNA vaccine and compared both the Moderna vaccine and the Pfizer vaccine, and checked the humoral and cellular response. They were eligible, they checked, included 248 eligible patients. At the last, after some of them lost of follow-up or refused the vaccination, or were admitted or have COVID-19 infection. So at the least, we have 75% patients who received the Pfizer vaccine and 100 patients who received the Moderna vaccine. As we see here, almost all of this, 95% of the patient developed a humoral response with protective levels of IgG and anti-spike protein. It was similar for both the Moderna and the Pfizer vaccine, but the cellular response was lower in both of the vaccines. The cellular response, it was also almost only in 60% of the patient. Some of the patients with a lower cellular with no cellular response were treated with immunosuppression therapy or transplanted patient. The choice, almost all of our patients received the vaccine in Israel. Also, only few patients refused to receive the vaccine, but I think we have almost all in our units, all the patients are vaccinated or are were confirmed for the COVID-19 infection. As it was published recently, some of patients around the world refused to take the vaccines for several reasons. Some of them, the reason why their choice, they have no faith in the COVID-19 vaccine. Some of them are non-compliant in the dialysis treatment. They didn't want to take additional treatment. They believe, some of them believe that COVID-19 is just flu, so they don't have it. They don't, in general, don't take the flu vaccine, so they didn't want to take the COVID-19 vaccine. Some of them don't believe, we believe in the media reports and that all overheated and they are not convinced in the benefit. Some of them have stated of allergic to vaccine, and a few patients refuse to give the reasons for accepting the COVID-19 vaccination. In conclusion, high infection rate to COVID-19 virus was observed among maintenance hemodialysis. The COVID-19 increased the mortality rate in HD patients, so the vaccination is considered a priority for HD patients. Vaccination should be encouraged but accompanied by continuous adherence to precaution and measures, including the use of face covering, proper hand hygiene, and social distance. It's true that we have now the fourth wave of COVID-19 infection with the Delta variant. So we have in Israel, we now have new patients. So we have to adhere to the covering, to the face mask, hand hygiene, and social distancing to prevent the infection with the new variants. But we still, since the low level of IgG antibody levels, we have to know if the scheduling regime should be established for this specific group of patients. So it may be different from the vaccination protocol for the general population. This study for this issue are going on and trials are ongoing. And thank you for your auscultation.
Thank you. Thank you very much, Dr. Khaled. I invite our participants to write questions. And meanwhile, I have a question.
Yes.
Do you have any data about the response rate for the vaccination in the population of transplanted patients?
Okay. Okay, just a minute, please. I will stop shared. I still sharing my?
No.
Okay. Just a minute, please, Evgeny. Okay. At a patient on transplanting kidney patients have a lower level of seroconversion, less than the HD patient. So the protocols now that running in Israel, that the transplanted patient should have the third vaccine shot. So we have more reinfection in transplanted patient with the COVID-19 more than the HD patient.
Okay. Okay, thank you. We have one question from our participants. In your experience, which is the rate of hemodialysis patients who refuse the vaccination? I think that you touched it a little bit during the presentation.
Okay. In our experience, we have almost 100 patients that will need a vaccination. Only 1 or 2 patients refuse the vaccination, and then they revaccinated. They accepted later, and they were revaccinated. In other study from published recently, also they were from 28 patients, only 8 patients refused to do the vaccination. We have around between the 5 to 10% of patients refuse the vaccination. So we have to work hard on this population, this patient, to convince them to be vaccinated, because we can save their lives.
Okay. Thank you. You know, our patients are well known as the patient with low compliance. So I think taking this into consideration, the rate of the vaccination was really high.
Yes.
Another question from me. What about now when we have the Delta variant, and you know we are talking about the third dose for the general population? What's your opinion about the third dose for the dialysis patients?
Okay, for my opinion, it's like this. It's no. We have only one in our unit. We have only one patient who had was infected after the second dose of vaccination. In the data published from Nazareth and Hadera, there were 6 patients from almost 200 patients who were reinfected after the second vaccination. So the rate of revaccination is published about 3 to 5%. Okay, and we don't know what will happen with the Delta variant now. 2 recently published data published online and accepted for publication showed that after the third dose of vaccination, they have an increased rate of IgG levels. So the humoral response, it's good after the third vaccination, but in my opinion, to the lower rate of reinfection in the dialysis patients that we observed, we can wait for the third vaccination. Maybe we have to measure the IgG levels, and according to this, to decide which patient may benefit from the third vaccination.
Mm-hmm. Okay, thank you. We have one more question here. Just a moment. I want to read it. Okay, the question is regarding the young patients. Is the different rates is there a difference between the young and the more older population for the response of the COVID vaccination?
Older patients, they have less response, also in the general population and the dialysis patient. Patients over 75 have less response. Not only in the dialysis patient, it was published by the others groups. Patients over 75 have less levels of the IgG levels, serum IgG levels. And also in the general population, older patients have less response.
And regarding the compliance, what do you think? The younger, you know, in general, the young people are less at risk for the more severe disease. What was the response rate among the younger population of dialysis patients? You know, they can say, we will be okay if we will be affected due to our young age.
In our local units in area, all the patients we accepted the vaccination almost. They're also young and older patients accept the vaccination. I don't know in the other units how it was, but I think in Israel it was the staff and the patients were minded to get the vaccine. So the rate of vaccination in Israel is very high. In the immunocompetent patient, immunocompromised patient, cancer patient, dialysis patient, transplant patient, we have a high level of acceptance for the vaccination.
Okay, thank you. And there is one concrete question. Do we plan the third dose for the autumn of this year?
For all?
for patients. No, we're talking about dialysis.
About patients. I think we have to measure the immune response, the levels of IgG, and to watch the patient. I think maybe older patient and the patient that immunocompromised that are treated with immunocompromising treatment, I think that they need the third dose. The other young patient with the high levels of IgG, I think we can wait and see what's going on before decide if to get them the third shot or not.
Okay, so we will see. Another question. Did you have seen any advanced effects of the vaccination in your unit?
The most of the adverse events were local. I think, in my opinion, I didn't study. I saw more adverse event in the general and the healthy population than in the HD patient. I don't remember any reported from our patient. If you remember, Evgenia, you can help me in that. But I don't remember the adverse event in the dialysis patient.
And I think that in our unit we did not have any complication after the vaccination, but maybe the literature have some cases about it.
The published data show that the most adverse events were the local events. It's like pain in the arm, in the injection sites, swelling. Few patients developed fever, but most of the adverse events were local events.
Mm-hmm. Okay. The participants asked us if the vaccination mandatory for healthcare professionals.
I think yes. In my opinion, we have to protect ourselves, our families, and our patients.
Yes, by law, no, but due to our experience and our current situation, I agree with you.
We are almost 8 months after the vaccination as the medical staff. We were vaccinated in December. Now we are entering to August. I think we have a lot of experience in vaccination, a few adverse events, and I think we have success in limiting the disease in Israel by the vaccination.
Okay. Thank you. Any other questions from our audience? I think that we don't have any questions, so it's the last chance for people to ask questions. I think that we are really in, you know, living now the future, I can say, because tomorrow maybe we will have a new research, new data. Very interesting time.
It's an ongoing. It's an ongoing disease. So we have, and the data is published every day. We have a new data, new experience from different groups. So we have to learn a little bit more to learn about the vaccination. I think that the vaccination it's safe. At least in our experience here, in our local experience. All our families are vaccinated, and we will try that all our patients will be vaccinated. Regarding the third shot, we have to see the ongoing study, the reinfection rate with the new variants. So it should be decided in the near future, but until now we don't have robust data to recommend the third shot. It's what's found that higher seroconversion level in after the third shot, but we don't have reinfection. We have a few reinfection in the dialysis patient and not on the general population. And now in the dialysis patient, we have a few cases of reinfection. The rate it's less than 4%.
Yes. Yes, so I hope that we will stay like this. And what do you think? The third dose, it's supposed to be the same vaccine, or Pfizer will develop something else more with adjustments to the new variants or whatever?
We don't know how the new variants respond to the old vaccine. So I think that the vaccination will be all just ongoing research. So it will be improved and improved with the time. So because we have different variants, every few weeks we have a new variants. Until now, most of the variants have highly response. Also the Delta virus have highly response, not as the first variant, Chinese variant, but we have a good response for the vaccination. So improving the vaccination is ongoing. And we will see in the near future what's going on.
We have another question. What is the proper time to provide vaccination, you know, during this treatment, before the day without treatment or whatever?
Okay, to increase the compliance of the patient, it must be done on the day of dialysis. This is one point. So because the patients they can get they come to this unit, they get the receive. In our protocol, the vaccine was performed before the dialysis treatment. The patients have to wait between about half an hour before the start of the dialysis. And we increase the compliance like that because the patient came to the dialysis, get their vaccination. They don't have to move to other vaccination centers or family care centers to get the vaccination. It was easy to us to give them the vaccination. I think it's proper to get it in the dialysis unit if we can do it before and all the hour. As I said, we perform it before the dialysis treatment session.
Does vaccination can have influence on the anticoagulation treatment during the dialysis?
It's not checked. We didn't check it that, so I have no answer.
Okay. The question was regarding about the before dialysis, if the vaccine can be dialyzed through the dialysis filter, you know. That was the question.
The vaccine it's intramuscular. It's not intravenous dialysis. Intramuscular, it's not getting to the blood.
Okay. Okay. Thank you. So I hope that we answered the question. and the participant is satisfied with our answer. Okay, if we don't have any other questions, thank you very much, Dr. Khaled, and I hope that the vaccination will work with the new variants. And I wish to all our participants to stay safe and healthy. And I would like to invite all of you to the EDTNAERCA virtual conference that will take place from 4th to 7th of September. It's fully virtual, and our scientific program is almost ready, and it will be published very soon on the website. Please follow us, and I think it will be a very interesting and fruitful event. We'll also touch COVID there during our conference. We have a panel dedicated to the COVID. So you are invited to register and to participate in our conference. Thank you, Dr. Khalid again, and thank you for attending this webinar. And stay safe again. Bye-bye.